Our two systems had worked together some, but there had always been this uneasiness, this tension, and I think some sense of competition.
Delta Center really provided an opportunity to be very intentional about building those relationships.
Scott Engelmeyer and Michelle Ponce describe how their respective associations are working together as the Kansas team for the Delta Center for a Thriving Safety Net, an initiative launched in 2018 with funding from the Robert Wood Johnson Foundation. JSI led a national Delta Center team, including strategic partners from the National Council for Mental Wellbeing, the National Association of Community Health Centers, and the Center for Accelerating Care Transformation. The goal was to advance policy change at the state and national levels and practice change among community health centers and community-based behavioral health organizations. Grantees used their Delta Center funding to support a broad array of policy activities, including background research, education and training, stakeholder engagement and convening, and building shared policy agendas. The Delta Center helped seed relationships that bloomed over time into powerful collaborations that, through funding by state associations and other sources, led to significant policy victories and practice changes.
One thing we've been working on together since before the Delta Center project is Medicaid expansion. Kansas is one of 10 states that has not expanded Medicaid, and there seem to be all kinds of barriers to that. We're part of a coalition of organizations that are working on that.
Before the Delta Center project, the associations worked closely only during large events.
Through the Delta Center, it really forged a relationship that was deeper than that. Rather than kind of coming together at big picture rallies, we were able to talk on a deeper level about what each organization's policy priorities were, to identify places that maybe we could collaborate on that we didn't think of. Contacting each other to partner on before, and also identify areas where maybe we disagree, but how do we get past that, or how can we come to a middle ground?
It's a recognition of what the other organization is doing in policy and learning about that that's maybe helped us either head off some conflicts or certainly recognize that there is some common ground there where we may not be in 100% agreement, but if we're in 90% agreement, we can move some things forward.
Primary Care Association worked closely with the Behavioral Health Association to change policy at the state level to fund certified community behavioral health clinics as a way to deliver behavioral health care in the state. It was a huge policy. The state legislature funded it at $75 million.
Like most states, we are experiencing a workforce shortage, a crisis really. So anything we can do jointly to start growing our own, looking at students high school, maybe younger, and talking about the benefits of going into healthcare as a career, building additional opportunities and career ladders.
Additionally, health equity is playing a large role in their conversations about new policies that the two associations are working on.
This issue of equity is even probably at the forefront, even more so than perhaps some more private practice organizations. We deal with it every day, and it is at the forefront of what we do.
We say that our policy priorities are all tied around equitable access to health care. We want to make sure that as we're developing those priorities, we're speaking to the communities that are affected. And, rather than us sort of in our ivory tower looking at data and saying, oh, we know what's equitable, we want to make sure that what we believe from the data or things that are equitable issues really are things that reflect the needs and the wishes and the desires of the communities that are affected.
They hope the relationships that began to bud at the start of the Delta Center grant will continue blossoming when the funding ends.
We're both primary care and mental health safety net. And I think that safety net organization brings a lot of passion. People don't do this work because it's easy. They do this work because they have a passion and they really want to help people. And at the end of the day, whatever we can do to support both networks and the work that they do ultimately helps the people of Kansas. And that's what our jobs really are.